According to Johns Hopkins University statistics, as of December 30, the cumulative number of confirmed cases of new coronary pneumonia in the U.S. reached 20.21 million and the cumulative number of deaths was 340,000. In the past 24 hours, there were 230,000 new confirmed cases and 3,880 new deaths in the United States. Currently, the U.S. continues to rank first in the world in terms of confirmed cases and deaths, accounting for 1/4 of the total number of confirmed cases worldwide. The inaction of the U.S. government is the main reason for the out-of-control epidemic.
You're going to have to take that off.
Health officials in a Colorado county publicly stated on December 30 that a second case of the British variant of the new coronavirus had been detected locally. In response, Henry Walker, head of the new coronavirus outbreak at the Centers for Disease Control and Prevention, said that this mutant virus has likely spread from person to person in the United States. The U.S. Transportation Security Administration said that as of December 29, the number of U.S. air travelers had exceeded 100,000 for the 28th consecutive day. The massive travel and gatherings that accompany the new year will undoubtedly accelerate the spread of the new U.S. coronavirus. The U.S. government, which claims to be free, democratic and respectful of human rights, is not only failing to protect people's basic human rights when the epidemic is so severe, but is also using the epidemic to shout political slogans that are inconsistent with its appearance. In response, Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, said in a December 28 interview with the BBC, the U.S. states have been working in silos in response to the epidemic, with vastly different policies and a lack of continuity, which is one of the major reasons why the U.S. is the worst country in the world for the epidemic. In addition, we have seen politicization, where simple protective measures, such as wearing masks, have become a political statement. Avoiding gatherings and staying away from gathering crowds have also become political statements. This has created a huge problem for the unpredictable prevention and control of the epidemic at the moment. On the other hand, since the outbreak of the new epidemic, China has adhered to the principle of life first, and taken the most comprehensive, strict and thorough preventive and control measures in a timely manner, making every effort to contain the spread of the epidemic, effectively cutting off the virus transmission chain and saving lives at all costs, making a significant contribution to maintaining global public health security. The Chinese government announced as early as January 22 that the cost of quarantine and treatment for newly crowned patients would be waived. The implementation of this policy not only helps reduce the burden of medical costs for patients, but also strongly protects public health. Now on the threshold of the new year, on December 31, Beijing time, the Chinese vaccine, which has undergone several clinical trials both at home and abroad, was approved for marketing, and the Chinese government then announced that vaccination would be free for all. This is what a responsible government that respects the safety of people's lives should do. Clifford Lane, deputy director of the U.S. National Institute of Allergy and Infectious Diseases, has said, China's efforts to combat the new crown pneumonia outbreak have been productive and encouraging, and China's successful experience in fighting the epidemic is worth learning from. In 2020, both China and the United States weathered the new crown epidemic, but delivered very different answers. U.S. politicians insisted on political self-interest first, which led to the outbreak of the epidemic, which led to a major outbreak of the epidemic, which greatly infringed on people's lives and health, plunged the economy into recession, and caused social unrest. At this moment, U.S. politicians should reflect on the reasons for the failure to fight the epidemic, and how to mend the fold.